Hi, I'm Dr. Nixon with Healing Peak Regenerative Medicine's Longevity Channel, and today I want to talk about hand pain or hand arthritis. It is a widely, pretty broad issue. Lots of people have arthritis in their hands. The most commonly arthritic joint in the body is this one right here, our thumb joint. One of our thumb joints. We have a couple. So the reason why I want to talk about this is because if you're someone that can't open a pickle jar anymore, like can't turn caps, can't turn anything, then most likely you have arthritis in your hand. Even numbness, tingling, aching pain in the hand, sometimes diagnosed as carpal tunnel, may not be carpal tunnel. It may be arthritis or a combination of carpal tunnel and arthritis, especially if you're someone who uses their hands a lot, like a hairdresser or an artist or an electrician or a mechanic, landscapers. Lots of these people who are wrenching or gripping a lot or using their hands a lot or have their hands up in front of them like this are going to typically have more likely arthritis later in their life than another person. And the reason why I wanted to talk about this today is because there really aren't any treatment options other than over-the-counter anti-inflammatories like ibuprofen or Tylenol or more stronger prescriptive anti-inflammatories. You can do cortisone injections, but typically short-lived, and you have to do repetitive injections throughout your life. And so you can't get a hand replacement. Maybe at some point, you can, right? But not in these cases. And so, there are no carpal bone replacements. Carpal bones are the bones in your wrist right here. And so it leaves a lot of limited options. You're kind of left with management of care, like physical therapy, chiropractic, massage, acupuncture, all really amazing modalities and treatments, but often they leave something to be desired. Even if you're going bi-weekly or every month, those therapies typically are not lasting that entire period of time, or it gets frustrating that you've been going every month for 10 years and the pain is getting worse, or the stiffness. Also, range of motion can be lost by arthritis. So when arthritic gets into the joints, it can make it more difficult to bend the dips and pips. Dips are these joints and pips are these joints. And even that mobility, the loss of mobility, even if it's not hurting you, they're your hands, right? So you use them to do lots of things. It can really limit the freedom that you experience in life if your hands are not working well. So what can you do about that? Prolotherapy and platelet-rich plasma injections are extremely effective in treating arthritis in the hands. Thumb joint pain, inability to open containers, fingers that no longer bend. Even if you have severe bony deformities from osteoarthritis in your fingers, prolotherapy and PRP can reduce stiffness and improve the mobility in those joints and reduce pain. The bony malformations that have happened will not go away, but you will get more out of your hands. You'll get, the joints will start to move, the pain and stiffness will be dramatically reduced, and you'll be able to open jars and write letters, better penmanship, and maybe paint more, or play the sport you had to stop because your hands were bothering you so much when you played. And that's a big deal, right? Because when there's such limited options for people to really get these things treated, they just accept the degeneration of many joints, but like two really important pieces of equipment, right? Your right hand and your left hand. And they just were like, okay, well, that's just the way life is going to be. Unless I want to take over-the-counter medication every single day, which is not good, right? It has lots of other side effects. It's okay to use that stuff once in a while, but daily, you're really going to start to see issues with the digestive system or the liver, or cognitive decline. Over-the-counter pain medications, or even prescription medications when they're used daily, come with some serious side effects. And, whether you know that or not, it's good to educate yourself about what you're taking, especially if you're doing that daily. There are supplements that can help with arthritis as far as like pain goes and inflammation in the hand. And those are very commonly well-known things like boswellia and turmeric and fish oil, things that increase circulation like ginkgo biloba. There are lots of different things you can also apply topically to those joints as well as take internally. If I'm not your doctor, please ask your doctor before you start any new supplements in case you're on any medications that conflict. If you are my patient and you're watching this video and you want to know more, please message me through my portal and I will, help guide you through this process or have you schedule. So I just wanted to let you know today that if you know someone or if you are someone who has debilitating loss of range of motion, it's a mouthful. Debilitating loss of range of motion in your hands or fine motor movements, or if you have pain in your hands or wrists, that prolotherapy and PRP can be extremely effective for these conditions. And if you want that range of motion and that pain gone, please reach out to someone who does prolotherapy and PRP because it will change your life. And if you're in this greater Seattle area, our phone number is 206-899-6000. We would love to talk to you. Please like, subscribe, and share this video. Thank you so much. Have a good day.